My name is Dr. Hartej Matharu. I started my first practice in March 2020 called the Cosmetic Dental Gallery. And that was a practice we built from scratch and we built from the ground up. I then went on to open a second squat practice in Battersea, so the same name. So now we have two locations. And we're a practice that has multidisciplinary providers. When we were looking to open these branches, we wanted to make sure we had the latest technology in terms of imaging, digital technology, digital smile design, intraoral scanners, all these things, because a lot of these things combine to enable us to provide the best level of treatment for our patients. It's important for us when we're doing implant work to see anatomical structures, to visualize bone in 3D, so that we know what size implant, width and length to use, and then also to be able to track anatomical structures. But some of the more advanced features that have come through, say on the Green X machine, is the ability to image teeth for root canal treatment. So you can actually map the canal system, measure it volumetrically, and potentially even get surgical guides made so that your access is pinpoint. So there's a lot of advanced application of CBCT. Alongside that, we've also got the panoramic or panoramic images that you can take, and we take a lot of those images prior to orthodontic work to assess root length and bone. And then obviously if you have the feature to, you can also take a KEF. So combining all of these fields really gives us a sense of accuracy, and we know that we're providing the best forms of treatment for our patients. So when I was opening my second clinic, I was having a look around other CBCT machines, and Vatech I'd been aware of for quite some time. And actually comparing the image quality versus some other brands, I use a Plan Mecca at the other branch. It's very, very different. The level of definition in the imaging that we get from panoramics or CBCT is a lot more sophisticated. So when we're actually trying to take imaging at both branches, we're finding that planning from the Vatech machine is a lot easier. And we feel that the clarity of the machine is far superior to many of the other brands on the market. I just felt like I wanted to have the best of the best, and for me the Green X was that machine for us, and since we've invested in it, I haven't looked back. I've been really, really happy with the performance of the machine. I think the support from Vatech is fantastic as well. If you ever have any issues or you need clarification on positioning for patients, you can call the team and they get back to you instantly. So I feel the whole package from Vatech, from the machinery to the software to the customer support, is very, very good. And they give you a lot of assistance to make sure your image quality stays at the top standard. Onto the software side of things, the manipulation of the image is super easy. You can rotate different slices. You can change the cross sections really, really easily, and there's loads of different views that you can get, and you can trace the panoramic path file very well. So it's very, very easy to look at different angles, look at different planes, search the whole image at the click of a button. And versus some other softwares where you can't actually rotate the axis, you can't rotate cross-sectional views. So if you're trying to angle the image so you can see the exact angle of which you're going to place your implant, you can't do that on other softwares, but you can on Vatech software. So for me, the software is very, very intuitive, and it really facilitates easy planning. So that combined with the great image quality that this machine produces, those are the best features for me on the Vatech.